You know, there are a lot of promising developments right now with all these potential vaccines, treatments, relief, strategies for dealing with the coronavirus. But the one that is getting a great deal of attention right now is Regeneron's antibody cocktail. Dr. Devi Nampiaparampil joins us right now. Doctor, this is getting an enormous amount of buzz, and I always get leery of getting ahead of ourselves on a potential treatment or vaccine. But the fact that so many are kind of circling around this, what is the significance?
Well, there are a couple of things. So this morning, Regeneron announced that its antibody cocktail seems to be effective in both preventing and treating COVID in hamstrings and monkeys. Now, it's always nice to hear good news or positive news, but unfortunately, I don't know if that particular news advances the landscape that much because they're already doing human trials. So normally when you do animal studies, it's to set up a basis or a foundation for doing the human studies, but they're already looking at prevention and treatment in humans. So that news doesn't necessarily change things that much. But on the other hand, I am optimistic about their antibody cocktail because while most vaccines are used for prevention, right? You inject the vaccine and then it's supposed to be sort of a something that lets the immune system know this is what the virus looks like. This is what you need to prepare for as a method of prevention. This actually can also potentially work as a treatment. So they're monoclonal antibodies, which means they can attach to the virus and signal the immune system, hey, this is where we need to fight. This is where the virus is. So for that reason, because it can be used potentially as both prevention and as treatment, I'm more optimistic about it. The one thing I am pessimistic about in general about these vaccines is that, we are talking about things as though these vaccines are just around the corner, that we have these large phase 3 studies going on in humans, that we have thousands, tens of thousands of people enrolling in studies. But it really makes a difference whether that vaccine is available in the fall of 2020 or if it's going to be available in the fall of 2021 or 2022. So I think people make their decisions just day to day based on this idea of when a vaccine or a treatment might be available. And it's very different if you're planning for COVID to be coming to an end maybe years from now versus within the next year, right? I mean, in terms of our education, our economy, all the day-to-day decisions. For me as a healthcare provider, what I see too, personally, just anecdotally, I see a lot more people succumbing to cancer, heart disease, things that are unrelated to COVID right now because they're either putting off treatment or what's happening is that they're losing their health insurance and they're not able to get treatment as effectively.
Real quickly, doctor, and you're right, there's so many competing for the right to get a vaccine out. The sooner the better. The president says well in advance at the end of the year. I don't know where that stands, but we're already seeing spikes in cases to any activity that is resumed in states where they're trying to dial it back. Certainly in baseball, where a number of teams, players, staff members have tested positive for the virus, to the point where the baseball commissioner is well aware of the possibility this season might have to be scrubbed. I'm just wondering, at what point do we have to acknowledge some spikes are going to happen, but shutting down everything shouldn't happen?
I agree. I mean, we need to have a well-articulated goal of what we're trying to look at, because in the past we used to say, okay, we're just waiting to try to shut down things, to stop the surge, to keep the hospitals open, to allow the hospitals to take care of people. But now it seems like people are waiting not necessarily for the surge to pass, but for the vaccine to come around. So I think that there's a lot of debate between people, and some people may not realize what exactly they're waiting for either. But to me, I think personally that we need to open, but we need to take a lot of precautions. We need to have the social distancing. We need to have the masks. We need to do these things. Right. And, there are going to be risks either way. But it's a very heated and charged topic. I don't think there's one absolute answer. Even within my family, there's a lot of debate. So hard to say for sure.
If they dare debate you, doctor, I'm going to have to give a talking to that family. Doctor, thank you very, very much. We'll see what happens. But you're right. This is happening in one household across the country, whether there are doctors in that household or not. We'll keep you updated on those various treatments and their companies behind those vaccines. Also keeping you updated. The corner wall and brought up more than 102 points.